Hi, my name's Kyle Morrison. I'm a student with Valdosta State University. I'm going to be completing an OSCE midterm assignment, and this is my patient Carly. Do you give consent to be part of this video?
Yes, I give consent.
Okay, let's begin. So first, chief complaint, why are you here?
Runny nose.
Runny nose, okay. When did this begin?
A couple days ago.
Okay. Look, sorry, the location, is it just your nose or does it run in the back of your throat?
Both.
Both, okay. Does it last all day or just certain times during the day?
Pretty much all day.
All day. What's the drainage like? Is it watery, runny?
Watery.
Watery, okay. What color?
Clear.
Clear, okay. Excuse me. Anything make it worse?
No.
Has anything relieved it?
No.
Or does it seem better at any time?
No.
Have you tried treatments?
No.
Okay. So that takes history of present illness. Let's cover past medical history. Any childhood illnesses?
No.
Okay. Are you up to date on your immunizations?
Yes.
Okay. Any adult illnesses?
Preeclampsia.
Okay. So you had preeclampsia. What medications do you take?
Prenatal vitamins.
Prenatals, that's it?
Birth control.
Birth control? Okay, good. Well, no, it's good to know. Any operations?
No.
No. Any allergies?
No.
Okay. Now, past family history. Let's start off with your father. How old is he? Is he still living? And what has he been diagnosed with?
58. He's still living, and AFib and high blood pressure.
Okay. What about your mom?
Still living, 56, COPD.
Okay. Maternal grandfather?
Not living, and that's all I know.
Okay. Maternal mother, grandmother?
Obese and not living.
Okay. And your paternal grandmother?
86, and she died of complications from a stroke.
Okay. Paternal grandfather?
88, and he died of cancer.
Okay. Now we need to cover social history. What's your occupation?
Stay-at-home mom.
Okay. Financial status?
Stable.
Stable. Stress levels?
Yeah.
Okay. Let's see. Who do you live with?
My husband, baby, and dog.
Okay. Any tobacco use?
No.
Drug use?
No.
Alcohol use?
Mm-mm.
Okay. Have you traveled outside the U.S. in the past 21 days?
No.
Okay. That covers all that. Now, a review of systems. So, general. Any kind of headaches, changes in weight, chills, fever,
No.
hair loss.
Well, yeah, but...
Wait, what do you mean? Yeah.
I guess from having a baby.
Okay. Let's see. So, HENT. You mentioned the hair loss. It looks like it's even distribution now. Let's see. Your eyes, any vision changes, blurry vision, tunnel vision?
No.
Okay. Any pressure behind the eyes?
No.
Okay. Any hoarseness in talking or speaking, sore throats? No. Okay. You mentioned the runny nose. Let's see. Any hearing loss?
No.
Any ringing in the ears?
No.
Okay. Respiratory? Any difficulty breathing? Okay.
No.
Any coughing up blood?
No.
Okay. Any difficulty breathing or catching your breath
No.
when you exercise, things of that nature?
No.
Okay. Let's see, gastrointestinal. Do you have any changes in appetite?
No.
Any changes in bowel movement patterns? Okay, genitourinary, any burning sensation when you urinate, any excessive urinating, excessive urination at night. Okay, musculoskeletal, any limited range of motion.
No.
Okay, any fractures, painful joints.
No.
Okay, neuro, any dizziness, lightheadedness, any seizures, anything of that nature, sensory differences.
No.
Okay, cardiovascular, any palpitations, chest pain, anything of that nature.
No.
Okay. So that takes care of the H&P. Now we're going to get to the actual physical exam part. So first we're going to look at the head. It's normocephalic, atraumatic, even hair distribution. For the face, we're going to test cranial nerve 7. So if you would, raise your eyebrows, lower, smile, frown, puff out your cheeks. Cranial nerve 7 is intact. Now we're going to look at the TMJ, popping and crackling noted. Now we're going to look at the sinuses. So I'm going to palpate. Any tenderness?
No.
Frontal, maxillary,
no.
ethmoid,
No.
sphenoid.
No.
Okay, good. And then we're going to test sensation, which is cranial nerve 5. So close your eyes. That's soft. That's sharp. Okay?
Okay. Soft. Sharp. Sharp. Soft. Sharp. Soft. Sharp. Soft.
Good. Cranial nerve 5 is intact. Now we're going to take a look at the nose. The nose is symmetrical. Let me get a light source here. If you'll take a look up for me, face me. Mucous membranes are moist and pink. Atraumatic. Septum is midline. Okay, good. Now let's test your smell or cranial nerve 1. What scent is that?
Peppermint.
Yep. It sure is. Okay. Now that we've done that, we're going to take a look at the ears. Okay. So I'm going to look for tenderness of the tragus, pinna, look for any buildup behind the auricle, any tenderness.
No.
Okay, gonna pull up and back. Tympanic membrane, sorry, is in neutral position with the cone of light in respect to the umbo at the 7 o'clock position. Okay, good. No arrhythmia noted. No drainage or exudate. Same process here, except the cone of light in relation to the umbo is at the 5 o'clock position. Okay. Good. And then no tenderness. Okay. So that takes care of the ears, other than a hearing test. So if you would close one ear. Okay, I'm going to whisper a 2-syllable word and you tell me what it is.
Flower.
Good. Other ear.
Puppy.
Good. She passes the hearing test. Now we're going to do the Weber and Renee test. First, we're going to do the Weber test. I'm going to strike the tuning fork and you tell me where you hear the sound.
Both ears.
Good. It's normal. Now for the Renee, I'm going to strike the tuning fork, place it on your mastoid. When you can no longer hear it, tell me Then I'll place it in front of your ear. When you can no longer hear it, tell me. Okay? Okay. So air conduction is twice as long as bone conduction, which is normal. Now we'll do the other side. Okay. Again, air conduction is twice as long as bone conduction, so that's good. So cranial nerve 8 is intact. Now, let's move on to the eyes. See, so for the eyes, we're going to start with a Rosenbaum chart. If you would take this, hold it 36 centimeters from your eyes. We're going to first test OU or both, with no corrective lenses. Start from the top and work your way down.
958-745 2843 638 8745 63925 428 365 37425 8 937 826 426 739.
Okay, good. Now cover your right eye. We're going to check OS or left eye, non-corrective. Go ahead.
958-742-843 638 8745 63925 428 365 37428 858 937 826 426 729 or 39.
Okay, so 20/20 vision for OU and OS. Now for OD, cover your other eye. Go on.
958-742-843 638 8745 63925 428 365 374 256 937 826. That's all I got.
Okay, so OD is 20/25 vision. Okay, good. Now if you would look at me, we're going to follow my finger for the 6 cardinal views of gaze. You were kind of all over the place. All right, good. So cranial nerves 3, 4, and 6 are intact. Now we're going to test peripheral vision as well. Tell me when you can no longer see my fingers.
Can no longer see them.
Good.
Can no longer see them.
Good.
Can no longer see them.
Mm-hmm.
Can no longer see them.
Good. Okay, that's intact. Now we're going to assess the pupils. Not mine. All right. Look at my nose. Pupils are equal, round, approximately 3 millimeters, or yeah. Okay. Consensual light response noted. Round reactive to light. Let's see. Watch my finger. Accommodation noted. Okay, now I'm going to directly observe cranial nerve 2. Optic disc. It's a little marginated. No signs of neovascularization or AV nicking. Good. Other eye. Okay. Optic disc is well marginated. No signs of neovascularization or AV nicking. Good. Okay. That takes care of the eyes. Now let's take care of the mouth. Mouth open wide. Good. Stick out your tongue. Move side to side, up and down. Say ah. Okay. Uvula is midline, rises midline. Mucous membranes are moist and pink. Dentition is intact. Keep opening. Okay. Good. And cranial nerves 9, 10, and 12 are intact. Now we're also going to test taste and your gag reflex. Open wide. What flavor?
Grape.
And gag reflex is present. Good. Takes care of that. Now let's look at your neck. Your neck, trachea is midline. Going to palpate the carotid arteries. They are +2 equal bilaterally. We're going to palpate the thyroid. Do a big swallow for me. Good. Okay, no nodules palpated. Let me take a listen to your carotids. Here, turn towards me a little. No bruit. No bruit. Good. Okay. Shrug your shoulders. Good. Turn your head. Good. Turn. Good. So cranial nerve 11 is intact. Now we're going to move on to the anterior chest. Anterior chest, going to inspect. No signs of accessory muscle use on respirations. Now I'm going to palpate firmitus. Okay. Go ahead.
99.
Good.
99.
Good.
99.
Good. Firmitus is palpated. Now we're going to check percussion for resonance. Good. Okay, takes care of that. Now let's take a listen. Take a deep breath every time I put my stethoscope on. Good, lungs are clear to auscultation. Now let's listen to the heart sounds. Aortic, second intercostal space, right sternal border. S1, S2 noted. Pulmonic, second intercostal space, right or left sternal border. Erb's point, third intercostal space, left sternal border. Tricuspid, fourth intercostal space, left sternal border. S1, S2. And lastly, mitral, fifth intercostal space, mid-axillary line, or excuse me, mid-clavicular. S1, S2 noted. Okay, now let's do posterior chest. Okay, same thing, we're going to add in respiratory excursion, so go ahead and take a deep breath. Okay, let out. Good. So my hands rose symmetrically. Now we're going to palpate fremitus. Say 99.
99.
Good.
99.
Good.
99.
Good. Fremitus is palpated. Now we're going to percuss for tympani, or sorry, resonance again. Resonance noted in all fields. Now we're going to take a listen. Just take a deep breath every time the stethoscope touches your skin. Okay, good. Lungs are clear to auscultation. Okay, if you would, lay back on that pillow there. So first, I'm going to take a look at the JV P. So turn that way. Okay. Looking for maximum impulse in the supra notch here. Okay. We're at 4 centimeters, which is within normal limits. And then we're going to take a look at the abdomen. Well, actually, let me check skin turgor while we're here. Non-tinting skin turgor. Let's see, now the abdomen, we're looking at contour, it's flat. Next, we're going to auscultate all 4 quadrants. Bowel sounds are normal active. Now the abdominal aorta for bruits, none are present. Renal arteries, none are present. Iliac, none are present. None are present. Good. Now we're going to percuss the abdomen, okay, for tympani. Tympani noted in all 4 quadrants. We're going to do a liver scratch test for the liver span. Stethoscope is beneath the xiphoid process. span is approximately 6 inches. It's within normal limits. Okay, now we're going to do light palpation. Any tenderness?
No.
Okay. Then deep palpation. Liver is palpable. No organomegaly. No nodules or masses noted. Okay. That takes care of the belly. Now you would take a seat. Okay, so now we're going to test the extremities and skin and pulses. So if you would, yep, there you go. Skin is dry, warm, intact. Capillary refill, less than 3 seconds. Less than 3 seconds. Okay, pulses, radial, +2 equal bilaterally. Popliteal, +1 equal bilaterally. Posterior tibial, +1 equal bilaterally. Dorsalis pedis, +2 equal bilaterally. Okay, now we're going to take my fingers, pull and push. Good. Same with the feet. Pull and push. Good. +5 strength noted. Now we're going to test the reflexes. So tricep tendon. Good. Bicep tendon. Good. Same here. Good. Good. Patellar. Good. +2 for the reflexes so far. Relax. Okay, Achilles tendon. +2. +2. Okay. Takes care of that. Now, let's test range of motion. Okay, so for the neck, we're going to extend, flex, good, laterally flex, good, rotate, good. Now for the spine, we're going to go ahead and stand up. We're going to flex, good, extend, good, rotate, good. Then, laterally flex, good. Okay, knee to chest, knee to chest. Now we're going to flex our arms up above, good. Then we're going to adduct, good. Then well, you can sit down if you want. Then we're going to extend. This is flexion, good. This was adduction or abduction, adduction, good. Now for the legs, we're going to, you might want to stand up for this. So for the legs, we're going to abduct, abduct, adduct, good, adduct, good, extend, or flex, flex, extend, extend. Good. Okay. You're smart. So, Now we're going to do the Romberg Test. Patient's going to close her eyes, hands out straight. I'm standing for support. She's not swaying, so this is a negative Romberg test. Good. Now we're going to also to test cerebellar, the cerebellar region. We're going to do tandem walking. So walk heel to toe, 3 paces and back 3. Good. Patient does this without difficulty. Now we're going to test sensory. So if you would, hold out both hands and close your eyes. Tell me what this is.
A wrapper with a stick in it.
Okay. Tell me what that is.
A circle heavyweight thing.
Good. Okay. So stereognosis is intact. Now we're going to close our eyes and do proprioception. Raise your arms out. Is your left arm up or down?
Up.
Good. And then your right?
Down.
Good. Feet? Up or down?
Oh, which one?
Up or down?
Up.
Good. Up or down?
Down.
Good. Okay. That takes care of sensory. Then that's it. So that concludes the OSCE full assessment in H&P. Thank you.